cardiac arrest is complete cessation of heart activity, complete stoppage of the heart. That is what a cardiac arrest is. Whereas a heart blockage or a heart attack is different. A heart attack can lead to a cardiac arrest, but a heart attack is something different. Heart attack means that there is some part of the heart which is not being supplied with blood, and that is why you have a heart attack. So there are three vessels in our heart. If there is blockage in any of them because of cholesterol being deposited or calcium deposits, or because of any of these cholesterol deposits rupturing and a clot forming there, so that is a heart attack. Sometimes, as a complication of heart attack, a cardiac arrest may occur. Heart blockages. This is one of the reasons for cardiac arrest. Second could be the disturbance of the heart rhythm. That happens. That is also a complication of heart blockages. Also, in some people, it is they have some birth defects which can lead to changes in heart rhythm, and this can lead to a sudden cardiac arrest. Or it could be a sudden change in the heart's pressures. So somebody could have suddenly have some rupture of some valve, and that could be one reason of cardiac arrest. So cardiac arrest is a medium through which death happens. So cardiac arrest itself would not be heart blockage, but cardiac arrest happens because of number of reasons. It could not only be the heart; it could be something else also, or could be sudden trauma, that a sudden blood loss. This could also lead to cardiac arrest. Experiencing a cardiac arrest, such patients would generally have complete loss of consciousness. Patient would fall down, and it would be a sudden event. And in that event, it is best to start with CPR. So CPR is cardiopulmonary resuscitation. So with that, rapid pumping of the chest, as well as if somebody is trained in CPR, can give 2 rapid breaths after 30 pumps. And this has to be done very rapidly at a rate of about 120 per minute. So cardiac arrest, suddenly there'll be a fall in the patient and loss of consciousness in such a patient. You should always check for the pulse in the neck, so which would tell you that this patient is in a cardiac arrest. Cardiac arrest itself, you would see the patient, like I said, fall in front of you, and there would be complete cessation of cardiac activity. So for diagnosis, like I said, as a bystander, because this generally happens outside the hospital, because in the hospital, we have the patient hooked onto an ECG, and we can diagnose at that point of time that there is no electrical activity. But outside the hospital, the easiest way to diagnose that the patient is having cardiac arrest is patient will have no pulse. So that is why I said to check the pulse in your neck. Your carotid artery is here. So you check it if there is no pulsation there. So that means this patient is having cardiac arrest, and start immediate CPR. For cardiac arrest, the treatment would be, first of all, any bystander who's there, any kind of CPR that they have seen on TV or they know how to do CPR, start with CPR. So it is, circulation has to be maintained. So we are pumping the heart in the CPR with chest compressions. And also, if there are 2 people there, one person can give 2 breaths after 30 pumps. And like I said, this has to be done at a rate of 120 to 150 per minute. So I believe that CPR is the need of the hour. It has to be taught to everybody in schools, in colleges, and if available at that point of time, first of all, you have to call for help so that patient can be taken to a hospital. And till then, continue with chest compressions and 2 rapid breaths every 30 compressions. So that is what we can do. But if you're alone, call for help and start chest compressions immediately. So that is how a cardiac arrest can be handled outside the hospital. First would be stop smoking if you are smoking. That would be the first thing. Second would be dietary changes. So in dietary changes, you have to include salads in your diet. So always keep a bowl of salad on your table and consume that first before we go on to our main meal, because it fills us up. It removes a lot of cholesterol from our body. It also helps in stopping people from having constipation. So it has a lot of benefits. Fiber has a lot of benefits which comes with the salads that we eat. Second would be to remove the Western diet from our diet now. So that would be removal of breads, removal of pizzas, pastas, and anything which is made of refined sugars. And also to decrease the amount of chapatis, increase the amount of vegetables in our diet. We can also have chicken and fish. There is no problem with that, but only thing is it should not be always fried, because whenever we fry something, so the molecules of the oil also change. The one that we any oil that we use, that the molecules of that also change. We should try not to consume fried foods. Third would be to increase the timing between your intake and your sleeping. So if we increase that time to say 3 to 4 hours, and during that time we are mentally as well as physically active. So supposedly we eat our food, we probably go for a walk or walk around the house or do something which is consuming energy. And then after that we sleep. If we just eat and sleep, so we are not actually consuming that energy. We are storing that energy. And then obviously exercise is a big part. So exercise should be done if you can do it. Uh, if you haven't started exercise, start with 5-10 minutes, and then you can maybe go up to 30 minutes, because 30 minutes is recommended at least 5 days a week. So any form of exercise, may it be walking, may it be running, may it be lying in your bed and exercising. You could do a chair workout. All these workouts are there online. Also, then stress comes into play. So, like I rightly said, so you have to do some amount of meditation. Some amount of stress relieving factors have to be there. So, if you keep on worrying about everything that everybody is saying to you, so then stress won't go away. So, whatever doesn't trouble you for the next one year, let it go.